And Dream Team skin editor Dr. Jason Michaels is here with more. And yep, Doc, I missed you last time. I was on vacation, but you came in and filled us in on the latest and greatest techniques and technology and whatnot. Today we're talking about ethnic skin and the damage that could be caused.
Absolutely. Different type of skin types respond very differently to different treatments, and there's a lot of considerations that I really take in mind when I'm evaluating a patient. And so different skin thicknesses and the oil productions of the skin, genetic variability, and certainly how that skin heals. But probably the biggest issue is really the pigment level or the amount of melanin that that patient has.
Okay, and I do notice now I sometimes see on a darker person very white spots. How does that happen?
It's a very common consideration and a problem, actually. A lot of it is founded in inflammation of the skin. So when an injury occurs and inflammation responds to that injury, it can either make that injured spot darker or it can make it lighter. And so what you saw was a lighter spot. Right. But some patients get darker spots, and unfortunately some of these damages can be permanent.
Oh, really? And what are some of the treatments that you can do for this damaged skin?
There's a lot of different type of treatments that we take into consideration. They're not always easy and they don't always respond. And certainly I would seek the attention of a board-certified dermatologist or plastic surgeon if you were ever to encounter that. Now, I did bring a picture of a patient that I had seen in my office. I'm not sure if the producers have that.
Yeah, it's right there.
This patient was a patient that came to my office for help, came to Aspire for help because of a burn that they sustained through IPL therapy for laser hair removal. And you can see the crusting on the left and the development of the pigment irregularities, which in some patients are really permanent marks on those patients' faces. Now, fortunately, I was able to give this patient a complete response to 100% improvement, but not all patients are going to improve that way and get so lucky.
Yeah, it looks like there's a lot of deals, though, at least for, you know, a lot of opportunity to get a treatment in Las Vegas.
The market is very unregulated, unfortunately. There's a lot of lack of supervision. So again, when it comes to these treatments and you have ethnic skin, those considerations are very important. And sometimes popularized treatments like laser therapy are not the ideal treatment for patients of color.
Interesting. Anything non-invasive, anything that you can do? I mean, for instance, just as simply as drinking water, is there anything that just will make your skin healthier no matter what?
Well, I think water certainly is important, but you know, even on the element of having an African-American patient, sunscreen is even important for that as well. We still believe in topical products like retinol products because they stimulate collagen production, so all different races can really use that as well. As far as procedures that you can do on darkly pigmented patients, there are procedures out there, but again, you need to go to someone that is skilled in the treatment modalities for those different type of patients.
And you know, Monica, she jokes around with us, and she's like, yeah, hey, you want to go tanning? You know, and she thinks it's a joke, but growing up on the beach, I know that ethnic folks can get tanner than their normal skin color, and it's important to protect it.
Absolutely. And so on the element of cosmetic improvements, that's one thing. But on the other element, just because you have dark pigment in your skin doesn't mean that you have a zero risk of the development of things like melanoma. So melanoma risks are elevated in patients that get more sun exposure. And so you do need to protect yourself, unquestionably.